Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's jump right in. Today, we're basically going to be medical detectives. Our case file opens with a patient who has this just bizarre collection of symptoms that, at first glance, they make absolutely no sense together. It's a puzzle that seems totally impossible, but the solution, it's elegantly hidden right inside the brain's own blueprint.
So here are the facts of the case. A 75-year-old woman suddenly feels like the world is spinning violently around her. She can't swallow properly, she feels numb, but get this, only on the left side of her face. And at the exact same time, she's got numbness on the right side of her body. And to make it even weirder, her muscle strength is perfectly fine. No weakness at all. What in the world could possibly connect all of these things?
And that's the central question, right? This isn't 4 or 5 separate issues happening at once. In medicine, you're always looking for that one single unifying diagnosis. So what one thing, gone wrong, could produce this exact, really peculiar set of clues?
Every good investigation needs a breakthrough, That one key piece of evidence that just cracks the whole case wide open. And in this story, our first major clue is something neurologists call a crossed pattern. This is the key that tells us exactly where we need to start looking.
The smoking gun is this: symptoms on one side of the face combined with symptoms on the opposite side of the body. Now, this isn't just a random coincidence. This pattern is like a giant flashing neon sign that points directly to one specific part of our central nervous system, the brainstem. That's the critical junction box that connects the brain to, well, everything else.
And this illustrates the pattern perfectly. The numbness on the left face is ipsilateral, which is just a fancy way of saying it's on the same side as the problem in the brainstem. But the numbness on the right side of her body is contralateral, meaning it's on the opposite side. Understanding this whole same side versus opposite side thing, it's absolutely everything.
Okay, so now that we know where to look, the brainstem, we can start connecting each symptom to a specific malfunctioning wire or structure inside that area. Let's trace the evidence one clue at a time.
First up, that intense, sudden vertigo. The feeling that the room is spinning isn't just some vague sensation, it's a very specific neurological sign. So, what part of the brainstem is in charge of our balance?
Boom, right here. This is the vestibular nucleus. You can think of it as the brain's internal gyroscope. It's constantly processing information about motion and where your head is to keep you balanced. Damage that, and you're going to get severe vertigo. So, check. One symptom accounted for.
Next on the list, the difficulty swallowing, which is called dysphagia, and also losing a gag reflex. This is clearly a motor control problem, right? Specifically with the muscles in the throat. So what's controlling those?
Well, the structure responsible for this has a pretty cool name. It's called the nucleus ambiguus. It basically acts as a command center, sending out motor signals to your throat and larynx. So a problem here perfectly explains why she's having trouble swallowing. Check. Symptom 2, solved.
Let's move on to our third clue: the loss of pain and temperature sensation on the left side of her face. Now remember, this is on the same side as the swallowing problem. That is a super important detail.
The structure responsible for this is the spinal trigeminal nucleus. It's the receiving station for all the pain and temperature information coming from the same side of the face. So a lesion right here explains that ipsilateral facial numbness perfectly. Okay, 3 down, 1 to go.
And here it is, our final major symptom. This is the one that really creates that crossed pattern we talked about. The loss of pain and temperature sensation on the right side of the body, basically from the neck down.
This is caused by damage to something called the spinothalamic tract. This thing is a major nerve highway carrying pain and temperature signals from the body up to the brain. But here's the really cool part. These nerve fibers already crossed over to the opposite side way down in the spinal cord. So by the time they're traveling up through the brainstem, they're already carrying signals from the contralateral side of the body. And just like that, the entire crossed mystery is solved.
But wait, there's actually one more piece of evidence, and it's about what's not happening. The patient has 0 muscle weakness. This is hugely important because it tells us that the main highway for voluntary movement, the corticospinal tract, must be totally unharmed. The problem is very, very specific.
Okay, the investigation is pretty much complete. We've got vertigo, swallowing problems, same side face numbness, opposite side body numbness, and no weakness. All the evidence is on the table. It is time to identify the culprit. So let's put it all together on the map. You have the vestibular nucleus, the nucleus ambiguus, the spinal trigeminal nucleus, and the spinal thalamic tract. When we highlight all of them at once, I mean, look at that. They aren't just in the same neighborhood. They are literally right next to each other, all clustered together in one tiny, precise location.
And that location has a name. All of our evidence points to a single spot, the lateral medulla, a very specific part of the lower brainstem. This precise collection of symptoms actually defines a specific condition, lateral medullary syndrome, which is often called Wallenberg syndrome. It's a type of stroke, and it's caused by a blockage of a tiny artery that supplies blood to this exact patch of neurological real estate. One small blockage causes this whole cascade of seemingly unrelated symptoms.
And we can be really certain of our diagnosis. If the stroke had happened just millimeters away, in what's called the medial medulla, the symptoms would be completely different. You'd see significant muscle weakness and other signs that our patient just doesn't have. The symptoms are a perfect match for a lateral lesion, not a medial one.
So, solving this mystery is more than just a cool piece of detective work. It reveals something pretty fundamental about how we're all built. What's the bigger lesson here? The big takeaway is this: the brain isn't just some disorganized blob of nerves. Not at all. It's a meticulously organized map where every single function has a specific physical address. The symptoms a person feels are a direct reflection of the geography of the damage. By reading the symptoms, you can literally read the map of the brain. So the crucial point is that this bizarre constellation of symptoms, the vertigo, the trouble swallowing, and that telltale crossed pattern of numbness, all without any weakness, it isn't a random collection of misfortunes. It is a precise neurological signature. It points a flashing arrow directly at one spot on the mat, the lateral medulla. And it's just a powerful reminder that inside our skulls lies this hidden, logical, and ultimately understandable world.